What happens during a bladder biopsy procedure? Imagine a tiny camera and tool working together to help doctors understand what's happening inside your bladder. That's what a bladder biopsy is all about. It's a key step in diagnosing issues like bladder cancer. The process usually takes place during a cystoscopy, which is a procedure where a thin, lighted tube, called a cystoscope, is gently inserted into your urethra and guided into your bladder. Before the procedure begins, you might be asked to urinate to empty your bladder. Sometimes, an antibiotic is given beforehand to reduce the risk of infection. You will also sign a consent form, which explains what will happen and confirms you agree to the procedure. The doctor can perform the biopsy under local anesthesia, which numbs the area, or under general anesthesia, where you are asleep. This choice depends on your health and the complexity of the procedure. Once you are comfortable, the doctor carefully inserts the cystoscope through your urethra. As it moves into your bladder, the camera on the cystoscope provides a clear view of the bladder lining, helping the doctor spot any unusual areas. To improve visibility, your bladder may be filled with a sterile, clear liquid. This makes it easier to see the walls and identify any suspicious spots. When the doctor finds an area that looks abnormal, they use tiny instruments passed through the cystoscope to carefully take a small tissue sample. This sample is usually about the size of a grain of rice. The tissue is then sent to a laboratory where specialists examine it under a microscope to look for signs of disease, such as cancer cells. After the tissue is collected, the cystoscope and instruments are gently removed. You might notice some discomfort or see a small amount of blood in your urine afterward, which is normal and usually temporary. Following the procedure, you will be monitored for a short time to ensure there are no complications. Your healthcare team will give you specific instructions on how to care for yourself during recovery, including drinking plenty of fluids and watching for any unusual symptoms. A bladder biopsy provides vital information that helps doctors determine the best next steps for your treatment or management. It's a safe, effective way to get a closer look at what's happening inside your bladder. Remember, always consult your healthcare provider for personalized advice and to discuss any concerns you may have about the procedure.